Hey
Yeah,
Josh.
morning. I'm so
Gosh,
sorry.
it's like waiting for a doctor to join the Zoom.
Oh, I
You
think it's
were
pretty funny, actually. But seriously, I'm sorry. Yeah, I'm like 25 minutes late. Feel free
That's
to put that
okay.
in the podcast.
That's all right. I'm fairly confident this one we know pretty well, so we can run through it. Today, we're going to be doing a review of a 2020 paper that came out in the International Journal of Colorectal Disease. The title of the article is Value of an Interactive Phone Application in an Established Enhanced Recovery Program. Josh, do you want to give a blurb about the authors?
I mean, there's quite a few. So I mean, and all of them are affiliated, or at the time at least, were part of the Rush University Medical Center colorectal surgery team. So Devan Schlund, Jennifer Poirier, Anuradha Bhama, Dana Hayden, Theodore Saclarides, Bruce Orkin, and Joanne Favuzza. I think a couple of them have kind of moved on to different locations now, but I think at the time they were all part of that team or department in some way. And kind of just same context for this. So SeamlessMD partnered with Rush starting in late 2016, and colorectal surgery and their ERS program was the first implementation we did at Rush. And so, this study is based on data, or at least a sample of the data from the last several years, I guess you could say. And so, for those who just don't know anything about patient engagement or SeamlessMD, just for context, basically Seamless is a patient engagement platform that guides patients through their healthcare journey via interactive digital care plans. So, for example, in the context of what you're going to see or learn about today in this paper, SeamlessMD was used to guide patients through all of their pre-surgery and post-surgery aspects of the colorectal ERAS pathway. So in this case, patients are getting on their phone, tablet, or computer reminders of what to do at the right time, when to carb load, when to do their bowel prep, etc. They're getting daily tasks about, start and mobilize day one post-op, do this for incision care when you go home. And then very importantly, patients are tracking data about their progress or symptoms. So they're being, pinged on their phone or their email to log in and actually track what's your pain. Are you compliant with your ERAS protocols? Do you have any incision concerns when you go home? And then back at the hospital, there's a whole robust dashboard that providers can use to look at all kinds of data, whether that's, ERAS compliance data, pain data, et cetera, to improve outcomes over time. And so certainly hopefully that gives you a bit more context for what we did at Rush, at least at the very beginning. And they've been wonderful partners over the years.
Yep, absolutely. And so the purpose of this study that they then published in 2020, the main goal was to determine the impact of SeamlessMD, or this phone application, on ERAS compliance, as well as on clinical outcomes. So they took a look at length of stay, readmission rates, surgical site infections, and then also the total cost of care for patients who are undergoing elective colorectal procedures. And so just to paint a little bit more of the background behind the paper, there was a systematic review done in 2011 that showed for enhanced recovery colorectal protocols, the length of stay ranged generally between 6 and 11 days. And there was about a 15 to 20% complication rate. So that's kind of the baseline that this paper is going off of. In terms of enhanced recovery protocols, this had already been established in colorectal surgery. It had been around for, at this point, almost 2 decades since its inception, but slowly over time had become kind of the standard of care. And for those folks who may not know, enhanced recovery is really just a set of multimodal perioperative care protocols. So a standardized set of protocols for both the patient and for the providers to follow in hospital, before hospital, in hospital, and after hospital. And ERAS, or enhanced recovery, has been shown in multiple studies and meta-analyses to improve certain outcomes by decreasing the stress of surgery for patients. So it has a profound impact on length of stay and overall mortality. And this has been studied in a wide array of studies over the years. And so, like Josh mentioned, Rush had implemented a formal colorectal enhanced recovery program back in 2016. And then they also implemented SeamlessMD, or this digital patient engagement platform, near the end of 2016 and into 2017.
Yeah, sorry, I'm just giving more context. So it went live in, I think, 2017, but I think that for more context, they actually had ERAS before 2016. So they had ERAS and colorectal for, I think, a couple of years by that point when we had first started. Right. And then, they basically brought length of stay down to about 6 days or so. And then part of the reason they brought Seamless in was that, hey, we've had some success with ERAS, we brought length of stay down, I think maybe a couple of days or something like that, but it had plateaued at around 6 point something days. And so one of the reasons they brought SeamlessMD in was to say, hey, can we use Seamless to drive up better compliance to our ERAS protocols for patients and bring length of stay down further because we've reached a plateau. And then the second piece was around, can Seamless be used to more effectively deliver all of this ERAS education content for patients? Because the booklet was great. They actually have a really great patient booklet, but like many ERAS booklets, it's pretty thick. It's 30 pages. It's a lot to remember. And so they were very interested in the idea of using Seamless to break down those protocols into bite-sized pieces. And I'm saying this, I think there are a lot of ERAS programs in a similar place, right? Where they've been doing it for a couple of years, they've gotten good results, length of stay is down a day or two, but they feel as if they've plateaued, and they're wondering what's the next step in enhancing the patient experience and enhancing compliance to get better outcomes. Anyways, Alan, back to you, but just want to give more context there.
No, that's great. And actually, just a question I have for you, Josh. Do you know, was there like an anecdotal amount of evidence suggesting that maybe compliance wasn't as high as it could be for some of their protocols, or was that maybe a common thought with some of these enhanced recovery? Because it is quite an intensive amount of protocols for the patient to follow, and that is difficult to adhere to if you're just getting this paper booklet. Do you know if that was the main reason why they assumed maybe they had plateaued?
I don't know. I mean, I do think one of the challenges they had, which is true in many programs, is most programs aren't collecting ERAS compliance on, on a real-time basis. So that it's hard to know that. I had a bit more context for you. So they had first implemented their colorectal ERAS program in January 2015. So by the time they actually went live with Seamless, they had about 2 years worth of, let's call it, manual traditional ERAS in that program.
Okay, great. So the main methods in this study, this basically encompassed all patients who were undergoing elective colorectal surgery between February of 2017 to July of 2018. So they had their enhanced recovery protocols in place. They were pretty much a well-oiled machine. They had some fantastic results before implementing this phone technology, but now they wanted to take that further. So every patient included in the study, whether they were on the phone application or not, they all received the same standard of care, which was their enhanced recovery after surgery protocols. The main kind of pre-operative interventions included patient education, like Josh mentioned, in a booklet form that was provided by a trained nurse during the patient's pre-operative clinic visit. And then how they were enrolled into the study, or if they opted into the study, basically after that patient education portion of the clinic visit, patients were provided the option of enrolling into SeamlessMD. So this was an opt-in method, obviously, for the study's purpose, if they wanted to get SeamlessMD or not. And so, like Josh mentioned, SeamlessMD, or the phone technology, is basically a virtual technology that guides the patient before and after their surgery with all of these enhanced recovery protocols, education, protocol reminders, and then progress tracking for things such as compliance tracking, but then also other measures like, satisfaction and so on and so forth. But for the purpose of this study, they were really looking at, does the phone application actually improve compliance to our ERAS protocols? And then a secondary effect, does it have an impact on clinical outcomes like length of stay, readmission, SSIs, so surgical site infections, and total cost of care?
Ultimately, they had 289 patients who were enrolled in the study. So the majority had cancer or IBD. They looked at 147 patients with seamless and 142 without. And in terms of approach to surgery, 133 were laparoscopic, 156 were open. Within the seamless group, 60% were laparoscopic and 46% were open. And you can look at the data in more detail in the paper. And then maybe Alan, do you want to talk next about?
Yeah, I can hit on some of the compliance measures maybe. So what the group measured in terms of their enhanced recovery protocol was they wanted to take a look at oral intake, solid food intake, how many patients completed their bowel prep, and then also ERAS medication adherence. And so when it came to the oral and solid food intake, there was really no difference between the group that had the phone application versus the group that didn't.
There were, I would say if you look at the data, there were non-significant or trending improvements in increased compliance with the oral and food intake measures. So for example, for solid food intake post-op day 1 that they looked at in the seamless group, 38% met that goal, 31% met that goal in the non-seamless group. P-value was 0.3. So it wasn't statistically significant, but it was trending in the right direction. I think that's meaningful to say.
Yep. But I think more, and this is actually statistical significant results when it comes to the amount of patients who actually completed their bowel prep, for instance, with the phone application or with SeamlessMD, there was 74.8% of patients completed their bowel prep versus 66.2% in the non-SeamlessMD user group. So, and that result was statistically significant. And then beyond that, their overall ERAS medication adherence also was pretty significant. It was 82.1% with the application and 76.8% without the application. Those are the amount of patients who actually did do their ERAS medications. And then I think
we should just unpack some of the things as we go along, if that's okay.
Mm-hmm.
So for example, people often might ask, well, why would it be that a patient might be more compliant with their bowel prep or with their, ERAS medications or oral intake or all that? And so, I think one of the things we have to realize when it comes to ERAS programs is that when you're a provider and you've designed these pathways and you know them inside out, all the carb loading the patient has to do and bowel preps and, early mobilization, it's ingrained in you, it, in the back of your hand. But as a patient, you are going through one ERAS journey, maybe hopefully in your entire life, if at all. Right. And so you're the one who's typically having to follow this 30, 40 page paper booklet. You're having to, not only make sure you look at it at the right time and somehow take what's in this 3-page booklet and put in your calendar, before surgery or when you're in hospital and you're, maybe you're not fully there, you're recovering. You expect the patient to pull out this 30-page booklet and to do these things, or you're relying on a very busy inpatient nursing staff to make sure they reach every patient at the right moment in recovery post-op to make sure the patient's doing every milestone in a very complex healthcare environment. It's very hard. And so the idea is that you have something like a patient engagement platform where you basically take those 30 pages and you turn them into bite-sized pieces. And then you ping the patient so that the patient, preoperatively just gets a notification or a text message or an email saying, hey, it's time to do your bowel prep. And then one of the nice things that we do in Seamless, and Rush did this as well in their version of it, was if the patient got a message on Seamless saying, do your carb loading, let's say, they not only get that message, but there's hey, if you want to know why you should be doing this, click learn more. And so patients can actually choose to get more detail about that instruction to unpack. And by that, I mean, we explain to the patient in, grade 6 health literacy terms, well, what is carb loading? Why should I carb load? How does it help me with my recovery? Because what you find in the literature is that when patients actually understand why they should do something, they're more motivated to recover. And so it's not just that we're setting a reminder to the patient, we're actually explaining to them, like, here's why you should follow your ERAS protocol. And that empowers them, that drives motivation. And that same experience goes in the in-hospital part, right? So it's like, hey, to the patient, you get a notification, ding, you have to get up and walk today. And then patients actually can unpack further, well, why should I walk earlier after surgery, right? And so we're setting an expectation and we're explaining it. And I think the other part, Alan, and before I shut up real quickly, there's consistency in that, right? Because the truth is that in the hospital, staff members are changing all the time. Maybe you have new residents who are on the floor for 2 weeks, or medical students who don't know anything about the ERAS pathways. They're not actually educating the patient properly. So there's all kinds of points of failure in delivering a standardized protocol. So it's one thing for the hospital to say, hey, here's the booklet, here's the paper version that's standardized, but it's another to have something prompting the patient. Here's the protocol, here's what to do it, here's why to do it. And then, sorry, one last thing, Alan, I lied. The other thing that we didn't get into is that when patients go through Seamless during recovery, both in hospital and post-discharge, they're actually prompted every day to track how they're doing. So in hospital, patients actually are prompted every day to complete what we call a daily check-in, or really it's a digital survey, asking the patient, how far did you walk today in hospital? Right. What was your pain? What was your nausea? Did you have a bowel movement yet, which is important for colorectal surgery, et cetera, et cetera. And based on what the patient records and based on what the goals of the rush colorectal protocol was, the patient actually received feedback immediately on the application saying, hey, you walked 4 laps yesterday. Great job. You met your goal. Keep it up. Right. Or, hey, you said you didn't do your breathing exercises. It's important that you do them to, make sure your lungs are healthy and you get home sooner. Please do them today. And what we find in our clinical research, Alan, is that when patients are actually given that automated feedback, they're more motivated to follow and be compliant with the steps. They're more motivated to recover faster. And so there's all these unique elements of the experience that help drive up compliance. So I'm not surprised that some of these were significant. I'm not surprised that others were trending in the right direction. I think it all makes sense.
Yeah. I think the other point to mention is by digitizing some of this education, it can personalize the experience quite a bit more. So if a patient has a stoma, for instance, they're going to get care based on the fact that they have a stoma. Whereas, if you had the booklet, you'd have to be combing through that and find the pages that are relevant to you and the ones that are not. Now, I don't know for sure, but I have seen at some hospitals, they have different booklets to hand out to different patients. But again, that's requiring a lot of manual effort to figure out which booklets to give everyone. The other point that I'll make is around just the fact that an enhanced recovery program and the fact that there are these standardized protocols is really kind of this rote information. And so if we're using humans to deliver this kind of robotic information time and time again, we're not really leveraging their empathetic quality. We're not leveraging their actual experience of what they have knowledge in as, let's say, a nurse. They're not, if they're just going around telling patients, do this, do this, do this, that could be delivered over a phone, for instance. And that was kind of the whole point of this study. So I think more profound is the clinical outcomes and the actual results that we're seeing with clinical outcomes, which kind of made sense when you look at the precursors like compliance. It just naturally makes sense that the outcomes are going to change as well. So the first thing that I'll mention, the first outcome that we looked at was readmissions. And to be honest, the readmission rate did not really change too much between the two groups. So the ones with the phone and the ones without. And Josh, you can correct me if I'm wrong, but I believe they did not have remote patient monitoring enabled. So
no, so I think the fact that we saw no difference in readmission rates wasn't surprising in the sense that I would say for most of our partners, where they do see major reduction in readmissions, 50, 70%, it's precisely because they're doing, remote monitoring. And so in Rush's case, there was no nurse or PA who was getting any alerts or doing any real-time monitoring that, we have some partners like Rush where that doesn't fit their workflow. And so on the bright side, though, I think it's pretty incredible that they were basically able to give the patient seamless, say, hey, go for it, enjoy your experience. And they were able to drive, and we'll get into more of the outcomes, but we were able to drive significant benefit without a care provider having to monitor patients in real time.
Right.
Now, of course, again, I'll repeat that for partners who do that. Unsurprising, there's even more benefit to how you can get the most out of the platform. But I think it's pretty amazing that even just by giving the patient the app and the program, they were able to get higher compliance with the ERAS, and you'll get into just in a second actually better results. But maybe we'll go there first, Alan, and I'll unpack that further.
Yep, great. So when it came to surgical site infections, I think this to me was one of the biggest changes. So the patients who were enrolled on the platform, there was about a 3.4%, 3.4% had a surgical site infection versus the patients who were not enrolled in the program, there was an 11.3% of them who had a surgical site infection. So the reduction there is about 70%. And this was statistically significant in its results. So big, huge change on surgical site infections with the app. Further to that, length of stay. So the mean length of stay with the group that was not enrolled in the program was 6.4. The group with the app had a mean length of stay of 4.4. So a reduction 2 days of length of stay. And again, that was statistically significant as well. So huge reduction in length of stay. And both the SSIs and length of stay together correlate to the total cost of care. So when we're looking at total cost, the group not enrolled, the average was $13,946, and the group that was enrolled on SeamlessMD, the average was $11,560. So a reduction of about $2,300 per patient using the app. And again, that was statistically significant as well.
Yeah, so here's what blows my mind, right? You have a situation where literally you're not monitoring the patient, you're just giving them this experience, and you're dropping SSIs by 70%, length of stay by 2 days, total cost by over $2,300, also significant changes. And why is that? Like, how could that happen? And by the way, these are results that some of the results we've seen at other programs with SeamlessMD. And just to unpack that further, so SSIs. So, why would that be? Well, again, this is all our hypothesis, because again, unless you do a deeper dive, it's hard to know. We're not there day to day, but I know one of the things in the RUSH ERAS pathway that we, did, in reminders and education interaction on was actually getting patients to do the pre-surgery chlorhexidine washes, right? And there's a lot of data showing that compliance with that leads to less SSIs, but prompting patients to do it, educating them on it in the right way, probably increased compliance, made a difference. Length of stay. I would say there's two main reasons that we see length of stay decrease when using Seamless. One is, we talked about this, Ellen, but all the methods we mentioned where we're driving up patient compliance with this ERAS protocol, right? Motivating them to walk sooner, eat sooner after recovery, doing all the right things. So getting better compliance to ERAS protocols, I think, makes a big difference. And then ultimately, when you're able to reduce SSIs, reduce length of stay in hospital, it's not shocking that the total surgical cost decreased significantly. Now, here's the interesting thing. Were there reductions in cost post-discharge? Not sure, because there was no readmission reduction. So, and there's no remote monitoring. But I think the fact that we could achieve those savings even from just giving the patient the application, saying good luck with it, I mean, that's incredible. I think one thing that is important to know is that if you look at most literature when it comes to patient engagement solutions, apps, things like that, you don't see results like this. I think at best, you usually see papers where feasibility studies, maybe okay engagement, but generally speaking, in most papers on this topic, you don't see impacts on length of stay and SSIs especially.
Right.
There's been some good work done on remote monitoring to reduce readmissions, but I would say there's almost nothing else that I've seen that shows impact on length of stay and cost in this way. And I think it's a good highlight that, and by the way, I think part of the challenge is that, so, Rush publishes this great paper, and it gives the impression that apps in general are improving outcomes and saving costs. But let's be fair, it's not like Rush in this paper is unpacking how Seamless works and kind of giving out all of our secret sauces and going through all the algorithms, interactions we put in the application. which and the user experience, which are really the secret sauce for why this works so well, right? All you know in the method in the paper is the ERAS protocol was delivered on Seamless. We gave it to patients, and outcomes were great. Like they have no room for explaining. And I mean, I know we can't expect them to know as frontline staff members all the secret sauce in how we designed the platform in the first place. And so I think on the bright side, I think papers like this show the community the promise of patient engagement when it's executed well. I think the challenge, as is always the case in literature, is that 90% of the papers are going to show no benefit. Let's be honest, because execution's hard, you know? And so it's, I think people in the community need to take this with a grain of salt. And, you know, if I was someone in the community, I would actually want to understand, well, how are you getting these results? And I can tell you, yes, sending reminders to do your, you know, pre-surgery chlorhexidine wash are helpful. But there's all these things that you and I have shared today around, oh, wow, we're actually having extra content and a certain way of explaining why you should do a pre-surgery chlorhexidine wash and tracking compliance with it and giving feedback about. There's all these extra things that you and I are describing. That's not in the paper, right? And you can't expect that to be in the paper, but it just shows you the how complex and robust patient engagement is getting. Anyways, I'll stop there, but
no, that's great. I thought it was neat as well. In the discussion section on the paper, the authors actually do mention a similar point in that, you know, there's a lot of studies out there on mobile technology that's either just looking at feasibility and they're also maybe not as successful, and they don't really dive into why, because again, like you said, there's not enough room in the paper, and sometimes they might not know exactly the specifics around why it is successful. But I think our added discussion here might help clear some of that up. The authors also go into some of the limitations of the studies. So they talk about the fact that it is a fairly small sample size. Obviously, it's one center. It's not, you know, a multi-site collaboration of you know, thousands of patients that are in this study. So definitely a small sample size. There is a lack of randomization. It is obviously a voluntary opt-in study. And they also acknowledge it doesn't measure the compliance to all of the ERAS components for this study in particular. And that's, I would imagine, because they don't have all of that data readily available for the non-user group. In SeamlessMD, like Josh mentioned, it's going to be collecting all of these compliance measures around their ERAS components because that's just built into the technology. And then the last limitation that I'll add here is around the technology itself. So we've briefly mentioned this, but the fact that the group took a completely hands-off approach where they're giving the technology to the patient, but not using it for remote patient monitoring in the post-discharge phase. So they're not actively, they don't have a nurse or a PA who's actively looking at all of their patients and figuring out, you know, where the pain score is trending, what do the wounds look like. They're not monitoring that to possibly prevent readmissions. So that's a possible technology limitation, I'll call it, but not a real limitation for the study. The purpose of this study was to look at ERS compliance and does this phone technology actually improve some of these clinical outcomes.
I mean, and this is another comment I'll make. And again, it's not about the author because they're not a technologist per se, or but you know, we describe it as a phone application, but the reality is the patients there could use the smartphone application. They could have gone their tablet. They could have gotten it on their web browser program. And so people often ask about accessibility. And again, it's one of those things where in the literature, the framing, you know, sometimes isn't, you know, fully comprehensive. Again, no fault of the authors, because it's not their job to be educating the market on different channels of the platform. It's our job. It's the market's job to do that. But I'm sure people would have questions about that, you know?
Right.
Yeah. Again, we don't get involved. I mean, I'll be honest, we didn't even know this thing was published. Like we found out this was published because it just came out on Google, and we said, "Oh, wow, this is really great."
Right.
So, anyways, that's always nice, though.
Yeah, that's a great point. I just wanted to add as well. I think for the length of stay reduction, in addition to there being possibly higher compliance to these ERAS components, and there's been studies from like University of McGill, for instance, that shows, you know, if there is higher compliance to these ERAS elements, then there does correlate with reduced length of stay. But beyond that, I wanted to mention just the fact that it inspires confidence for the entire care team, knowing that the patient is going home with this technology and this education in their hand. They can use the technology to figure out if they're having a problem. They know what to do in that case. And so it inspires confidence, I think, for everyone, the patient going home and the care team as well, knowing that the patient has the right information. So that could also have an impact on length of stay, at least in my head it would. So that could also play into the length of stay reduction overall.
Well, you're completely right, Ella, and I'll tell you, one of our customer partners is now doing same day colorectal surgery, which is rather unheard of.
Right.
And one of their criteria is that if the patient wants that option, they have to be enrolled on Seamless, so that way the care team can monitor the patient immediately after the patient goes home that same day. And because then it gives both the patient, again, like you said, provider confidence that, okay, you're going home like way earlier than we're used to, but we're going to stay in contact. We're going to know something goes wrong with you through the platform. And so as more and more surgery gets shifted to same day, as length of stay gets shorter, as hospitals face more pressure to free up beds, especially during COVID, experiences like SeamlessMD, I think are going to be critical parts of that strategy to safely get patients not only home, but supported at home. So it's not just getting them home, it's not just a discharge tool, it's really a support, experience safely for the patient.
Yeah, exactly. And I imagine, obviously that group is having more of a hands-on approach where they are monitoring the patients in case there is a potential sign of risk or something that's popping up, which may not be possible for everyone. But again, this study just proves you don't need to have that remote patient monitoring to still see some of that benefit. So having, for instance, a $2,300 cost reduction per patient without having any staff involved in remote patient monitoring or anything like that, it's just literally give the technology with your enhanced recovery protocols to the patient, and boom, there's your results. So that wraps up the study. I don't know if Josh, if you have any other additional points that you wanted to mention about the technology and or where Rush University is now taking the technology.
No, I mean, I would say we'll definitely link to the actual publication so that folks can read it. And I hope, I think what's nice about these studies is that we not only talk about the data from the author's point of view and the clinician point of view, but we're able to kind of unpack, at least from the technology side, why is it that some of these outcomes are achieved, or what are some of the best practices we're finding to be helpful. So I've enjoyed these sorts of opportunities, Alan, to unpack some of the outcomes. I think oftentimes what happens is you read it, and not even related to patient engagement, but you read these papers, but there's so little context around the intervention and how things were actually done. And what you realize is that the execution matters the most, but none of that information, or very little, can be fit into paper.
That's the thing. Yeah.
So I think that's the thing about the podcast.
It's often so difficult to explain all of that as well, because there are just so many, levers that are being pulled and so many different behind the scenes and back end inner workings of what the technology is actually doing. So just a very bare bones example is like, if the patient doesn't do one of the steps when they get that ping, well, then it's going to send the reminder at the right time accordingly. So just to improve that compliance, you're not going to write in there, the technology sent a reminder at this time and then another reminder at this time because the patient filled out a survey indicating X. Like, they're not going to get into all that detail, but there is that intelligent kind of detail that's making the technology successful.
Absolutely. So I look forward to doing more of these, Alan. I think this was fun. Yeah, and
definitely.
And readers, not readers, listeners, watchers, I guess viewers is the more modern term than watchers.
Yeah.
But if you have any recommended, patient engagement, remote monitoring type papers that you want Alan and I to debunk, break down, unpack, let us know. Happy to do it.
Yeah, absolutely. All right, so we'll end it there, Josh. Thanks again for joining the show. And to all our listeners, reach out if you have any suggestions for us in terms of papers or even questions regarding this paper. Like Josh mentioned, we'll link the actual paper in the show notes. So take a look at that. There's some great tables. They go into a lot of their statistical analysis on the results. So go ahead and check that out. But until next time, I'll see you later, Josh.
Thanks, Alan.